I'm Jeff Karnes, one of the urologists in the department here at Mayo Clinic, Rochester, with a subspecialty interest in bladder cancer. As you probably know, the first sign of bladder cancer is typically blood in the urine or hematuria, whether it's under the microscope or blood that the patient can see. And our first job is to figure out what grade and stage the patient may have in regards to the bladder cancer, as that dictates the next treatment course. And with the grade and the stage, we can subdivide bladder cancers into sort of low grade, high grade, and non-invasive and invasive. And the treatments dramatically differ depending on the invasive nature or the non-invasive nature. For those patients that typically do not have an invasive bladder cancer, we are now looking at newer agents to instill in the bladder as a form of treatment. Traditionally, these have been chemotherapy and an immunotherapy known as BCG. However, there's been newer chemotherapies that we've tried, cycling both a routine chemotherapy called mitomycin C along with gemcitabine, and have found that to be an adequate salvage therapy in patients who have failed conventional BCG. In regards to invasive bladder cancer and those patients that may require the removal of the bladder, we still feel like that a orthotopic ileal neobladder, which is a bladder made out of the patient's small intestine and placed in its natural occurring anatomic region, provides the best overall quality of life and no compromise on oncologic care. With that, our recent studies showing that hospital volume or provider volume matter in terms of outcome, and we consider our facility a high volume center when it comes to management of all bladder cancers, and in particular cystectomies and the orthotopic ileal neobladders. When it comes to the cystectomy patient having surgery for bladder cancer, as a department we have initiated a program to shorten the length of stay for hospitalized patients. And by doing this, we have actually shortened the hospital stay by 1 day, with much benefit to all parties involved, especially our patients. This involves use of agents in the operating room to cut down the risk of transfusion, to initiate early feedings with the patient, early ambulation are among some of those maneuvers. Once again, I'm Dr. Jeff Karnes in the Department of Urology in Rochester. Thank you for your attention.